Hello, I'm Tom Coffman. I'm the James R. Clapp Professor of Medicine and Chief of the Division of Nephrology at Duke University Medical Center. I also lead the Cardiovascular Metabolic Disorders Research Program at Duke NUS in Singapore, where I also serve as Executive Vice Dean. I'm one of the co-recipients of this year's Excellence Award in Hypertension, which I'm very honored and humbled to have received. And we'll be talking about our work over the past 20 years to study the AT1 angiotensin receptor, one of the critical receptors in controlling blood pressure and also a key target for current blood pressure treatments. Our work has used mouse models, primarily genetically modified mouse models, to understand the various roles of this receptor in health and disease. And through this process, we've uncovered and amplified understanding of the way this receptor works to control blood pressure and to cause hypertension. And over time, we think that these discoveries will help understand the way current approaches to treating hypertension work and what those mechanisms are, and also help identify new targets for therapy for this disease that affects over 1 billion people across the planet. So I originally became interested in the renin-angiotensin system in my capacity as a practicing nephrologist, where drugs that block that system are really a major part of our therapeutic armamentarium in treating patients with kidney disease. And it was through these clinical applications and questions that were raised, curiosity about patients that I've seen in the clinic, that really sharpened and honed our focus on this system. So back in the early 90s, when I was working as a visiting scientist in the laboratory of Professor Smithies, we hatched the idea of generating mice where the expression of the receptor was ablated genetically, and to use those animal models and to directly study those clinical problems. Because in order to study blood pressure and its consequences, you really need an animal model that has a circulatory system and blood pressure. What were then these new approaches to genetic manipulation in mammals had the potential to be quite incisive tools for studying these clinically relevant questions that we were interested in. This work arose from a long-standing collaboration with Professor Oliver Smithies at the University of North Carolina, and began with generating a mouse model that was deficient in AT1A receptors, the major AT1 angiotensin receptors in mice. And we used this model for more than 15 years now to understand the physiology of this receptor, both in blood pressure control, but also in control of body fluid volume, urinary concentration, and inflammation, and also in triggering mechanisms that actually oppose the development of hypertension. And it's in these latter findings that we think may prove most promising in developing new approaches or improved approaches to control blood pressure, where potentially using a new class of compounds called biased AT1 receptor agonists, that we could actually block the detrimental effects of the AT1 angiotensin receptor while promoting or enhancing these antihypertensive effects, so that we could, these compounds have the potential to be a new, improved class of angiotensin receptor blockers, which have the traditional effects of angiotensin receptor blockers to block the receptor, but these additional added benefits of promoting or this persistent actions to promote the blood pressure lowering effects of the receptor. One of the widely used antihypertensive agents in the clinic now, or class of agents, are angiotensin receptor blockers, which specifically block the receptor. And they block all the actions, both the good and the bad. What we hope, or we think our research may suggest, is that using these novel molecules that block the bad effects but potentiate the good effects may have real applications in clinical treatment of hypertension. And some of these compounds are already in clinical trials for heart failure, but we think they also might be quite useful for treatment of hypertension.